Hi, and welcome everyone to another installment of the Access California podcast. My name is Claire Courtwright. I am the Advocacy Director with Cal Voices and the manager of the Access program. I have our brand new program coordinator for Access California, Nicole Chilton, with me today to talk about community health workers. Nicole has been with Cal Voices for just going on a year, and she has spent a lot of her time here understanding community health workers and their relationship to peers, amongst other things. So, welcome to the Access podcast, Nicole, and I'll let you introduce yourself, and then we'll jump right into this important topic of community health workers.
Thanks, Claire. I'm really excited to be here today to talk about CHWs and a little bit about the history. Um, as you mentioned, I've been here almost a year and spent most of my time since 2013 in social services working in underserved communities.
Awesome. We love to have you. So I'll just kind of level set and start us off with respect to community health workers. Nicole will give us a little bit more of the deep dive, but the thing to know and the reason to keep listening is that community health worker is a type of medical healthcare provider that is recognized now in California and is a growing job opportunity for folks with what we call lived experience. And that means of a specific cultural or linguistic background, but also of a certain type of health condition. So, substance use disorders and mental illness are included. Um, and the history is interesting, so we'll start there. Nicole, where did the concept of the community health worker even come from, and has it been around a long time?
Yeah, community health workers have been around for almost 60 years as within the title. Was born out of the movement for mutual aid.
So that came, what we just call them the movements amongst my friends. So we're talking about this era in the country, especially in the 60s and 70s, when um, people were looking to serve their communities better and fill the gaps of governmental services that really weren't there for them. And so that's one of the things that is meant by mutual aid is people trying to take care of their own in the absence of resources. So it's very cool that that is where the community health worker came from. Um, and then community health workers in California, they can now bill Medi-Cal. They're recognized as a type of medical provider in California now. Is that right?
Yes, as of 2022, community health workers were able to begin billing within their scope of practice.
Awesome. So, most people in our community are familiar with CMPSS, Certified Medi-Cal Peer Support Specialists. And this sounds somewhat similar to community health workers. Um, and it is. Peers are included in the definition of community health worker because they have lived experience. So, can you say a little bit more about what this has looked like in California? I know you were telling me earlier there's a community health worker and then CHWPR. And can you tell us what those designations mean about lived experience?
Definitely. So CHWPR, the P stands for promotores, and CHWs are providing the support to individuals within the Spanish speaking community. So if they have that same lived experience, then the promotores is out in the community offering those services. The R stands for representatives and individuals who are supporting the Alaskan Native community or uh, Native Indian uh, are known as representatives.
Oh, that's cool. I didn't actually know that there were all of these other distinctions to honor different communities and really lift up that lived experience. So, is it the case that is it just that people have lived experience of a certain language or culture, or is it also like lived experience of health conditions, of a specific health condition.
Definitely health conditions, it's race, it's language, lived experiences also if an individual has been exposed to any type of intimate or partner violence. Uh,
Yeah, so it's really a big, so the lived experience that you have to have that qualifies you to be a CHW, that part of the qualifications, the lived experience part is pretty broad. It basically is very inclusive of all kinds of unique communities and paired with unique health conditions and cultures. I love that that exists. It's a really needed thing, and it's amazing that that exists. What about how accessible is this for folks with different educational attainments? Do you have to have like a bachelor's degree or a high school diploma?
yeah, to your point, that lived experience is pretty much the degree in life, right? So an individual's experience of navigating systems, overcoming barriers, and again, based on those characteristics and that we already talked about within lived experiences, um, a diploma is not required.
That's really important for folks to know because people with disabilities or substance use disorders or people who have experienced various forms of criminalization or exclusion, oftentimes, you know, having achieved a high school diploma is a thing that didn't happen because lives were disrupted and you know, to have job opportunities that don't require you to have a high school diploma is really very it's unique. And it
Mhm.
sounds like this is a job that has that holds a lot of purpose for folks because they're able to um, serve their own, and including with these types of lived experience that other people don't often see as qualifying you to be able to serve people. I think you had mentioned experience with partner violence, and there's a pathway. There's a way to become a CHW if you have a certificate in domestic violence. Can you say what that is?
Yeah, there are two pathways within that certificate. And so there's either the violence prevention professional, where if they participate in a certification program that's delivered by a certain entity within California and they receive that certificate, then they are able to provide those services only as that violence prevention provider.
Got it.
Mhm.
So it's a little bit like if you have a specialty certification in one part of serving the community, then that would be the scope of practice that you kind of have, or like what you do in a job. So if you had that certificate, then that would be kind of the role that you had in the community, would be like violence prevention within this sub community, which is cool. Can you say a little bit more in general, like the community health worker provides preventative services, is that right?
Yes.
And so what kinds of things are preventative health services? Like what kinds of things might a CHW be doing like with and for their employer and their client?
So a CHW might be providing health education, health navigation, screening and assessments, or advocacy supports. So
This sounds pretty similar to what CMPSS do. It sounds kind of similar to peers.
definitely.
So people that have that lived experience, especially if they have like a similar health condition, then they would know, you know, and a similar like linguistic background, then they would be like, okay, like I understand how to navigate the system that you need to navigate to get care, and here's how to do it. Or educating this community, or you said navigation, education, health screenings and assessments. So you're helping people figure out what they qualify for or need in terms of healthcare and perhaps other supports. And also advocacy, which we love. We love all the professions that involve advocating for your people within these systems from your lived experience, because anyone who tries to navigate healthcare right now, like, basically needs an advocate.
Multiple, shall I say?
Multiple advocates or tap each other
Hmm.
in and out. Like,
Hmm.
you need your coworkers and you need your CHW,
Yes.
because it's very difficult to access appropriate care in a timely fashion right now in our health systems that are pretty overburdened as things go. Um, so can you share just a little bit more for those, like, I think that if people haven't heard about this, that this might pique their interest. That there might be someone that listens to this, or is this podcast is shared with them and they didn't know about this role, and it holds appeal for them as something that they would like to do for their community and a job that is accessible and available to them. Can you say a little bit about how these services are billed in Medi-Cal? Is it just what you said, like, the provider has limited things that it can do with a client, so it's those prevention of diseases from becoming severe and disabling, and it's or preventing them, period, and health education, navigation, um, screening is a screening and assessments and advocacy. I think I got them all. Wow, good job,
You
me.
did.
Um, so is there anything else if someone is looking at this as a role, a potential job that they could get that they're interested in because it dovetails with their lived experience or their desire to serve their own community? Um, is there anything else that is important for people to know if they're considering, like, oh, perhaps, something that I want to do is be a CHW?
Yeah, so an individual needs to be at least 18 years of age to be able to bill Medi-Cal. That is a minimum requirement for that piece of it. Um, Also, that lived experience is a must as a CHW.
Not optional. And where are we? I know that the last time that I mean, I know a lot less than you do, but the last time that I checked in, it seemed like the state didn't really have a training program just yet for people to achieve the certificate that's required. Is that the most current, that the state doesn't have a training program just yet?
Yes, it's still on pause.
Okay.
So an individual, the other option aside from the certification piece is the work experience pathway.
Okay. So it is kind of like the for peer support workers, I know that when we first became Medi-Cal billable, there was this option, there was a work experience pathway where it's like we had people who've been working as peers for a long time. And now there's this certification you can get to attest to that from the state. And, like, how can you get it? And it sounds like it's kind of similar to CHWs, where you can become a CHW or be allowed to work and bill as a CHW because you have that work experience.
Yes, for up to 18 months, you can work as a CHW without that certification. And because that is on pause, that's just another avenue, another way to be able to allow individuals to continue working as CHWs. Um,
Okay, so you mentioned there is currently already an existing law, a pathway from is it violence prevention certificate?
Violence prevention. There's also gang prevention.
Oh, okay.
So that
So the
also,
I interrupt.
it's all right.
Okay, so those ones exist, and then there's a work experience pathway where if you have relevant work experience that would be qualifying, that's one way to get to be a CHW, but you don't have to have any kind of degree, even a high school one. And then there's gonna be at some point a training program, like a certificate from
Mhm,
a
mhm.
training program that the state will put out, and then you can go through this training program and receive your certification. And that's in addition to your lived experience. That's just the training piece after you have the lived
Yes,
experience. That's a must.
yes,
Okay.
definitely.
And do we know anything about, I mean, I just know from, I mean, we're used to certified Medi-Cal peer support specialists. Yes, peers can also be CHWs. That is clearly allowed. Medicaid confirmed that a long time ago from the federal government. Um, but one of the questions I have is, and maybe you don't know, you'll be like, let me get out my crystal ball. But to become a peer, to go through one of the peer training programs, it's a fairly short program. It's not months and months and months and years and years in order to become certified as a peer, because like you said, lived experience is the real, it's the school of life. You've already learned so much and you're just really learning how to apply it and maybe learn some of the logistical things like how to bill Medi-Cal or some rules of professional responsibility, that kind of thing. Do we have any idea with CHWs? Like, is it going to be kind of similar to peers in terms of the training requirement, or have they not really like given you a glimpse under the curtain of like how long you would have to train for to get that certification?
Yeah. Uh, what we have been told is that it would be 80 hours.
Okay. Very doable. Very doable for folks that want to be CHWs. And I know you had mentioned that, I mean, it's relatively new that California has embraced CHWs in a like full on, we're going to fund it. It's a policy of the state. We're really pursuing this. And so where does all of that stand? And I'm sorry if you mentioned this at the top and it went right over my head, but it's pretty new, right? Like California really only fully embraced and said, yeah, we're gonna have CHWs in our public health systems. So in Medicaid, that was 2022.
2022.
Yeah, so that's pretty new. And then have they put some money behind this effort to like stand up this workforce or have this workforce exist?
Yeah. The state is trying to expand the workforce to 15,000 CHWs by 2028.
15,000 by 2028. And how many do we have now?
Just under 7,000 as of 2024. Right now, there isn't an actual tracking system,
Mhm.
but we do have that knowledge based on assessments and evaluations over the last couple of years.
So it sounds like they're going to try to double the workforce in like just a couple of years. So thousands of people that they would like to see become CHWs. How are the job opportunities looking for people? Are people getting hired when they want to be CHWs right now? Are there job opportunities for folks?
Yeah, they're anywhere where you can think of where you would go to get support, hospitals,
Mhm,
clinics,
mhm,
outpatient clinics, also community-based organizations,
mhm,
nonprofits, peer-run agencies
mhm.
are also hiring CHWs.
Yeah. So, sounds good. It sounds like a really great job opportunity for folks that have that lived experience and may not have a high school diploma or have worked in some kind of capacity that is similar to this mutual aid or folks caring for folks from within their lived experience. It sounds like a really good opportunity for people. um, Especially it's so rare now to not have those educational requirements and to have people, I'm glad that people are coming to respect that lived experience means lived expertise and that things.
Yes.
You should, like, there are things that that are important to know, that you're able to like then leverage and serve your community with. So awesome.
All
Thank you
right.
for all of your work in, promoting and creating content around how to do this well, both with respect to being a community health worker, but also peer and bringing in all of our diverse communities. Is there anything else you would like to say about community health workers before we wrap up this introduction to them?
Well, I just look forward to seeing more and more CHWs throughout California being able to have the lived expertise and connecting with other individuals.
Absolutely. There's nothing like having someone that you feel understands you right off the bat to help you navigate all of the wonderfulness that is navigating healthcare right now. Well, welcome our new program manager, Nicole Chilton. Thank you so much for joining us on this Access podcast series. And hopefully, we will have you back in the future with updates on CHWs and other things. I always say I'm supposed to say, because I am supposed to say, like, share, and subscribe. And we hope that you will join us for future Access podcast series as we cover a great breadth of different things affecting the public behavioral health system and persons with lived experience. Till next time.